I'm Dr. Joan Fleischman, the founder of Early Options. This is our Women's Voices audio series where some of our patients have graciously agreed to share their personal abortion experiences. In this series, women talk about SofTouch, the quickest and simplest way to end an early pregnancy. It's a safe, non-surgical procedure that only takes 2 to 5 minutes to complete. You're hearing the voices of women as they're ready to leave our office and go about their day, only 20 minutes after their procedure.
I was initially very nervous, but actually felt pretty calm, very calm today. The pain was moderate, but again, not as invasive as I don't know, not expected, but thought maybe that I would feel. This just seemed for me the right choice.
In what way?
Just the controlled environment and not having to worry about like the heavy bleeding from the pill that we read about, and just how quick.
And you brought your boyfriend and you did some of the research, and how was it? We're really one of the only places in the country that includes men.
Yeah, no, it felt nice to be around her when the process was going on, and even in the research that we did, I mean, this felt like the least invasive procedure, non-surgical, and the fact that we can leave, within the hour just, makes it more comfortable for both of us, I guess.
Even just this whole process of reading through this and the fact that he was able to be here helped me a lot, I think.
So you just finished a procedure about 15-20 minutes ago.
Yes.
And how are you doing?
I'm doing great. It's not at all what I expected. It's a very simple procedure. I feel good. I thought that I was going to be more emotional after having gone through this, but I'm not. Everything was explained to me in detail. I was treated very, very well. Everyone was patient. It was just an overall great experience.
Once I made the decision to end it, it was a huge relief. And knowing that I can still get pregnant at 38, I wasn't too worried about getting pregnant in the future, just not right now.
Yeah, there's nothing about this particular procedure that's going to change that.
It was just uncomfortable. Like, it was more pressure than pain. Yeah, because it wasn't painful. It was just a lot of pressure. It's like twice the pressure of having a PAP. Yeah.
So now it's not so scary, right?
No.
And how fast was it?
Less than 5 minutes.
How did it go?
It was just as gentle as you described on your website, and that was one of the things that I was obviously worried about and cautious about, because you read so much online that the experience is going to be one way or another. And everything that you have transcribed on your website is the absolute truth, which is really special. This way is the only way, and every woman should know that. It was gentle, it was quick, and it was comfortable. And the fact that I could have had my boyfriend or a friend with me is a really special thing too for women who, want the safety or comfort of somebody else in the room. That's really special.
I'm generally anxious when it comes to any kind of doctor, and everything was explained, and while the procedure was happening, you were telling me what was going on, which was really helpful, and it made it more calm for me.
How is the pain level?
It's fine now.
Didn't you ask me before, should I be put to sleep for this?
Yes.
And what do you think in hindsight?
No, definitely not.
Why not?
Definitely not. It was just fast and easy.
How did the actual procedure go for you?
It really quick. It was very quick, and you guys made me feel very comfortable. And there was a small period of time, I would say under 60 seconds, of real extreme cramping that was unpleasant. But the rest of it was really just almost like a normal gynecological exam. You don't know what's going on down there, but it doesn't really hurt too much. And it was really quick, and it was over very quickly. So that was nice.
It's about 20 minutes later. How are you feeling?
I feel pretty good. I feel like there was pretty intense cramping, which I was told would exist, and now, I feel like I have my period. But it was really, really easy.
And you feel like you'll be able to work in a couple of hours?
Definitely.
So being able to come in today and being able to end things and move forward feels really good. And the procedure was really quick and it was more like period-like cramps than anything else. And yeah, it just, for me, of all the experiences I've had, this was the easiest.
So you just finished doing the SofTouch procedure a few minutes ago, and how did it go for you?
It was much less invasive, much quicker than I expected, not very painful, very gentle, comfortable.
And you came in here, you thought you were going to do the pill and hadn't heard of this procedure.
That's right. I thought the pill would be the simplest way to deal with it and the least invasive, but this was a better option because of the speed of resolution, and it is just, quickly over. You move through it much more quickly, much more easily, actually.
I hope these voices reassure you. I've been providing SofTouch to women for over 2 decades at Early Options. We've done tens of thousands of these procedures and have consistently seen what a relief it can be to have a quick and clear resolution to what's often a difficult situation. SofTouch is simple, gentle, and safe. From beginning to end, you'll be in your own private exam room with support by your side. Most women leave our office 20 to 30 minutes after the procedure, ready to go about their day. We feel everyone should know about this non-invasive option. So thank you for listening. We hope you'll pass this along.